Good morning, everyone, and thank you very much for joining our event. Let's start with the first session, which is about introducing the topics of the day. But is this the welcome speech? Yes. But before this, first things first, let me address a very warm welcome to our more than 220 registered attendants from more than 20 countries, covering almost the whole of Europe and even some countries. We have participants from all types of stakeholders, including hospitals, research infrastructure, universities and research. Shall I continue, or do you need some time with Yes? Good? Perfect, thank you. So again, a very warm welcome to all of our 220 participants. Actually, today I was informed we have 240 registered participants. Thank you very much, all of you who are here face-to-face, as well as all the attendants that are online. I'm very happy that we have stakeholders represented from all relevant areas, including large industry, SMEs, research centers, hospitals, universities, and many more, and attendants from the whole of Europe, as well as some non-EU countries. So thanks a lot. I have been asked to introduce the main topic of the day, and I would like to summarize it in one word. Fruits. Or maybe three words, low-hanging fruits. This is how I would invite all of us to conceptualize health data sharing. We hope that today will help us to deepen our understanding through the discussions on the many benefits of health data sharing, and for all stakeholders that are involved in the European health data space arena. Of course, this is not to say that there are only benefits. We are aware there are challenges. We all know that there are challenges when trying to share any kind of personal data, even more when we try to share health data. However, all of us organizing this event, and I hope all of the attendants as well, know that the benefits outperform the challenges, and eventually the time and effort required to overcome the challenges is really worth it and can bring a lot of gains for all involved parties. Today we will discuss about many aspects of data sharing. We will be discussing about technical infrastructures that allow the secure storage of data and interoperability of data. We will also be discussing about existing health data repositories that have managed to aggregate lots of health data, cancer imaging data, and how they have managed to overcome all the related challenges. They will be sharing some of their experiences with all of us attending this workshop. We will also be discussing about data processing tools that allow the exploitation of the data and the processing of the data in order to take advantage of interoperable data. And we will also be discussing about AI tools that have been trained and validated thanks to the availability of health data that has been shared and is helping to advance medical research. It is helping, it is supporting healthcare professionals to provide better care for their cancer patients. All of these are low-hanging fruits. This is how I would invite all of us to think about this. And they are also those that can lead us to a quick win, or maybe even not so quick, but still a win that is worth the time and the effort required to reach it and to overcome all the related challenges. We would like to invite all the participants of this workshop, both the speakers but also the attendants, to provide us their comments, their questions, their feedback on all of the topics that we will be discussing today, either through the questions today or even by using the email that we will give you in a few minutes. And send us all your comments, they are very welcome, and your ideas on how the challenges can be overcome. Before closing this speech, I would like to address special thanks to all those who have helped to make this event a reality. First of all, our local organizers, all the team from Medtronic, Laila, Lydia, many people from Medtronic. They have addressed in a perfect way almost all aspects of the organization, so thank you very, very much for this. Our team also for Fundación TIC Salut, especially Ana Belén, but also Susanna and all the team that have helped to widely disseminate the event as much as possible. And of course, the co-organizing teams, EUCAIM, especially Luis, our scientific coordinator in the EUCAIM project, who helped to create the agenda, to invite the speakers, again, all the aspects. The coordinators of the AI for Health Imaging projects, who also are co-organizing this event and help to populate the day with what we hope to be interesting talks and discussions. And of course, all of our invited speakers, all of the contributors to this workshop for their time devoted to our event. So I will close this presentation and the introductory presentation and invite our first speaker to give her intervention. Our first speaker is Mrs. Aleksandra Wesolowska from the European Commission, the unit, a program officer there, the unit on eHealth, well-being and aging. Aleksandra, thank you very much for your intervention, and the floor is yours.
Yes. Hello, everyone. Can you please confirm that you can see and hear me and see my slides?
Can see and hear you very well.
Okay, thank you, Gianna. Warm welcome to everyone. Thank you for inviting me. My name is Aleksandra Wesolowska. I'm a program officer in the eHealth Wellbeing and Aging unit of DG Connect. We work on digital policy. We support research and innovation projects and deployment actions in health. And we are the policy DG behind the INCISIVE project, the AI for Health Imaging cluster of research project, and also the EUCAIM project, the large-scale deployment action supported under the digital program. So I'm very happy to address you today to say just a few words about the European policy context relating to artificial intelligence and cancer, and a few European policy initiatives that are relevant to the topic of today's webinar. Let me start by briefly presenting the European policy context. So here in DG Connect, in the unit where we work, we work towards the digital transformation on health and care in Europe, and we have a strong focus on personalized medicine. We work in the context of the Digital Decade policy program, which is about the development of the digital economy in Europe, and which has ambitious objectives as regards the improving citizens' digital skills, but also improving the take-up of new technologies such as AI, data and cloud among EU businesses and public sector organizations. And also here we want to advance EU's connectivity, computing and data infrastructures. So on this slide, you can see some of big Commission priorities in the area of health in the yellow fields. So this is building a strong European health union, the Europe's Beating Cancer Plan, and also creating the creation of the European health data space. So here DG Connect works with obviously not alone, works with other commission services such as DG Santé and DG RTD. Then in the violet circles, you see the data strategy and the number of legislative instruments, either already adopted or in co-legislative procedure, that are relevant to the work and to increase the availability and provide a framework for data use in the European Union. So this is the policy and the regulatory context of our work. As for the funding instruments, we have 3 programs, mainly the Digital Europe program on deployment, the Horizon Europe to support research and innovation actions, and also the EU for Health program, which is the health, focuses on health and has a dedicated digital strand of actions. So if you look at the blue circles, the 4 blue circles, you see the big lines of our work, how we support the digital transformation of health and care. So in particular, we support the deployment of pan-European digital federated infrastructures for health data, which will enable cross-border access and federated distributed analysis of different types of health data. We also support the AI testing and experimentation facilities for health, where SMEs, small and medium-sized enterprises who have developed AI solutions can test them in real-life environments. We support piloting of cross-border exchange of health data in the member states, both health data exchange in the primary scenario, primary use, and for secondary use of health data. And finally, we support a network of European digital innovation hubs throughout Europe, which support the rollout and uptake of digital technologies among SMEs and public sector organizations. And many of them are active in the health sector and focus on AI technologies. Today's event focuses on imaging data and health data sharing for developing AI solutions in cancer. So I would like to briefly touch upon 2 EC initiatives relating to this topic, the European Cancer Imaging Initiative and the proposed EHDS regulation. So the European Cancer Imaging Initiative is one of the 3 big initiatives that DG Connect supports under the digital program. Next to the genomics, to the initiative, member state initiative around genomics that was launched in 2018 to enable secure access to genomics data for better research, personalized healthcare and health policy making. And next to the Virtual Human Twins initiative, which will be launched very soon. Here currently we have a coordination and support action to launch the ecosystem of all relevant stakeholders, and in the next steps, we want to establish a platform for computational models of organs and organ systems. And of course, then we have the European Cancer Imaging Initiative of most relevance to this event, which aims to link resources and databases to establish an open infrastructure of cancer imaging data and related patient data with the aim to foster innovation and deployment of digital technologies for improved clinical decision-making, diagnostics, treatment, and prediction in cancer care. So this is a big initiative, and it's a flagship initiative of the Europe's Beating Cancer Plan. It was launched to capitalize on and bring forward the work of the cluster of 5 Horizon 2020 projects, AI for Health Imaging cluster of projects, and the work under these projects sets the basis for the work in the Cancer Imaging Initiative. We have launched the initiative in December 2022, and the big deployment project that I will talk on the next slide started in January 2023. What is important to say that with this initiative, we want to bring together the different stakeholders, healthcare providers, research institutes and innovators, and support them in developing and making best use of innovative data-driven tools and technologies for cancer treatment and care. As I said, at the core of this initiative is a large-scale deployment project, EUCAIM, which will deploy the Cancer Image Europe platform. This federated infrastructure will provide a trusted framework for researchers, innovators, doctors, and patients, where researchers will have efficient access to more high-quality data to study and advance our understanding of cancer, and innovators will be able to develop and benchmark trustworthy AI tools based on imaging data. The distributed atlas of cancer images, which will be made available in the midterm, that is by the end of the EUCAIM project in end of 2026, will include over 60 million cancer images from over 100,000 patients. So this project is funded from the digital program, will last until December 2026. But what is important to say is that this project is set to deploy a sustainable infrastructure which addresses and caters for all stakeholders, and an infrastructure that will be growing in terms of data resources it connects. In the first phase, it will obviously connect the resources and data stemming from the repositories developed in the research projects, as well as from the existing research infrastructures. However, the goal is to include data from increasing number of hospitals and clinical centers throughout Europe, in alignment with the developments under the proposed EHDS regulation. And there will be opportunities to increase that amount of data. There will be an open call in 2024 by the EUCAIM project to involve additional providers, and there also will be other measures to support data provision to this infrastructure. And what is also important to say, in line with the data strategy and the mission of DG Connect, the focus of this initiative is a technology focus. So this infrastructure targets not only researchers, but it addresses clinicians, researchers, and innovators, with the overall goal to pave the way for a fast development of new tools to improve personalized medicine and innovative solutions in cancer care. And in this sense, the initiative is, in its goals, clearly aligned with the European Health Data Space initiative, and it contributes to the creation of the European Health Data Space in Europe. As you know, the European Commission made a proposal for a regulation on the European Health Data Space in May 2022. This is currently still under discussion. The overall objective of the regulation is the effective use of health data. The EHDS will promote better exchange and access to different types of health data, not only to support the healthcare delivery, so-called primary use of health data, but also for secondary use, that is data reuse for research and innovation purposes and for health policy making. So the European Health Data Space will be built on three main pillars: a strong system of data governance and rules for data exchange, data quality, strong infrastructure and interoperability, and there will be capacity building measures in the member states. So the regulation is still under discussion, but the preparatory work on preparing the implementation has started in a number of actions. For instance, as regard implementing the underlying infrastructure, this is being piloted now in a dedicated project, or as regards the metadata standards that will be used. But according to the Commission's proposal, many details regarding, for instance, the data quality or secure processing environments will be defined only at a later stage through implementing acts. And here what is important to say is that we are working towards aligning the infrastructure deployed under the European Cancer Imaging Initiative and the standards and operating procedures that will be binding under the EHDS. And we hope that the EHDS regulatory framework will further drive the availability of imaging data for secondary use, in particular for AI technologies development, and that equally the insights developed by this community, AI Health Imaging Cluster of Projects and EUCAIM, will inform the developments under the EHDS. So maybe a take-home message to finish my presentation is that Through these two actions, we hope to overcome some of the important challenges relating to imaging data availability in Europe for development of AI solutions in particular. And we call on all of you, on the different stakeholders, to see how you can contribute to these initiatives and benefit from them. And with this, I would like to finish and wish you all an interesting and an insightful event. Thank you.
Aleksandra, thank you very much for this very nice overview of the European Commission's activities and support towards the different digital infrastructures and cancer imaging initiative, all towards the European health data space. Thank you. That was a very comprehensive overview. Now, I would like to invite our invited speaker, Mr. Thanos Kosmidis, Dr. Thanos Kosmidis, to give his presentation. Thanos is the co-founder and CEO of Care Across, a digital health company focusing on cancer and an international leader in digital therapeutics. Through the experience and the intersection of health and technology, he has been involved in several international initiatives. Some include the European Commission's Cancer Mission, the European Commission's initiative on breast cancer health 2.0, and All.Cost International. Thanos is an advisor in an early stage venture capital fund with a focus on digital health and on an expert in residence at the Imperial College Lab, Imperial Lab. Thanos, thank you very much for joining us.
Thank you very much, Gianna. Thank you, Ms. Wesolowska, as well for this very good introduction, all the work you've been doing. Thank you for being here, thank you for being online, and thank you for being interested and involved. Clearly, big data and AI is something that is affecting our lives every day more and more. Let's go back in time. We're all in modern infrastructure, great building thanks to our hosts. Let's go back in time. You recognize this machine? What kind of machine this is? It's an MRI scanner. It's one of the first ones. Who in this room has had an MRI scan? Quite a few, okay. Hopefully not this old, right? A bit more modern. I've had some of mine as well. All good results, thankfully. And thank God, not like this gentleman here who's enduring this kind of process for actually going through an MRI scan. This is from the 70s, I believe. This has evolved, right? We're maturing the hardware. And actually, our gracious host in this event, Medtronic, also have this device, which is very much focusing on cancer and specifically colorectal cancer, a very tricky cancer to screen for and assess. So hardware has been evolving. This has been going over the past few decades. Now, of course, hardware on its own is not enough, and that's why this is a much modern machine, because software is at the core of what this does, right? So hardware and software together can really make a difference. And this may be a point where I can make a small confession. I was always a bit skeptical about AI and big data in cancer specifically. But why is that? The reason is that I had in mind always about, cancer. It's not like cardiovascular disease where every time your heart beats, you have a data point. It's not like diabetes care where you have every single day a glucose reading. It's more sparse, or so I thought. Because of course, the missing gem in my thought process was nothing else than imaging. So images can really provide all this data, can really provide all these insights that can make a difference. And this is very positive, and that's why we're all here. So we have been maturing, right? So we have the hardware improving, hardware, software, big data, AI, and imaging. But where are we now? As I was preparing for this presentation, as one does, I Googled, right? good job. And I was looking for evidence that we are there. The promise is here, right? We are here. And so I was focusing on breast cancer firstly, and in breast cancer, you have this challenge with a patient who has early stage disease, and we want to make sure that the disease will not progress into metastatic disease, a very different beast. So micrometastasis is when you have spreading of cancer cells to the lymph nodes, and it's almost impossible for the naked eye to see. And so guess what? This is where imaging comes into play. You all know this. You're part of these consortia. You're part of these groups. So I was reading all these nice presentations and these nice publications. And here is one. I'm like, this is the one I'm going to use. And I go into the data about the publication. Guess when this was published? It was about AI using AI for imaging to detect micrometastasis. It was published in 2011, 12 years ago. Like, okay, fine. Let's go do something else. Let's look at lung cancer. Lung cancer and low-dose CT scan is a key screening mechanism, almost a standard of care internationally, to help this very, very nasty disease get caught early. Lo and behold, more publications about the same challenges, more findings, and here is a publication which is very, very promising about the impact of AI to actually make sure that we have the screening tools in place. And I'm reading the paper. So the first patient was randomized in 2009. I'm like, something is wrong here. I mean, the clocks went back an hour, not like a decade. Like, what's wrong? So I think that what is happening is that the hardware is improving, is maturing, the software is maturing. We are trying to mature as well, but we're not really maturing. We're like young children, because we want to own and hold everything that we have in our institutions, in our companies. We don't really give back. We don't really share. So every time I was going through this MRI scanner, my scan was there, my pathologist, my doctor would see it. Okay, Thanos, you're doing well, you'll survive. And then back to that same hard drive, back to the same cloud, and not share. Nobody's gaining benefit from my 20 minutes of fame in this MRI scanner, right? That's a shame. That's a shame. So we're getting there. We're maturing, but we're not there yet. So I'm very happy to see that there is an institutionalized effort to actually make this a reality. It's an effort that without it, we cannot really go further, because every time an MRI scanner, every time a low-dose CT scan is taking place, otherwise we will not have this institutional memory. So I am really grateful for this work that you have been doing, for this work that the European Commission has been doing. And I really hope that the patients will get the benefit very soon. Because today the patients are not getting the benefit yet. The patients are waiting. The patients are waiting. The patients in Begonia Marañón Hospital are waiting. The patients in La Fe, the patients in Val d'Hebron, in Gustave Roussy, in Charité Berlin, in the Royal Marsden, they're all waiting. Why are they waiting? They're waiting for us to some extent. So this is your call to action. This is where all of you come. So we need to be more active. We need to be doing more of this. You need to be more upfront with this. And so let's imagine a future where no piece of data and no image captured from and for cancer patients is left to stay in silos, but gets shared privately and anonymously, impacting their health outcomes, with a vision to impact not only them, but every cancer patient after them. So maybe you can also read between and across the lines. Thank you for doing this, and thank you for being here. I'm really looking forward to the rest of the day. Thank you so much.